Hi, I'm Dr. Janice Davie. As a naturopathic doctor and integrative fertility specialist, I help couples to optimize their fertility through optimization of health. I help them to reduce their stress throughout their fertility journey, and I help to empower them along the way. What I'm most passionate about, though, is improving the health of our next generation through preconception and perinatal care. Over the last 10 years working with fertility patients, I've developed something that I call the Optimal Fertility Checklist. And this is an assessment tool that I use. It's also a visual guide for patients to sort of see where they're at and what sort of obstacles might be in the way of achieving a healthy pregnancy and carrying a baby to term. It really is a top 10 or a 10-point checklist really that we can see what work needs to be done. So during our time together today, I want to talk about one of the factors, one of the checkpoints on this optimal fertility checklist. And it's the very first one on the list, which is female hormone balance. This is also one of the pillars that we discussed during our Fertility Foundations program. So if you're listening to this talk and you happen to not be trying for a baby over the next 3 to 5 years, I invite you to listen on. What I'm going to be discussing today is what a perfectly balanced hormone cycle looks like. And then I'm going to be giving you top 3 tips to help achieve that regular cycle or regulation of hormones. Okay, so we're going to jump into something that I call the perfect period. And not to get into too much gory detail, but I am going to describe what a nice regular cycle looks like, what it does not look like, and then we can start to see if there's anything that deviates from this perfection or from this normal. We can start to see what imbalances lie and where we need to do a little bit of work to correct them. So the perfect period looks something like this. We should see a regular cycle lasting anywhere from 26 to about 35 days. There can be some variance in that, so plus or minus 2 days is what I usually say. So for instance, if you have a 30-day cycle, but 1 month maybe it's 29 days, 1 month it is 32 days, that's okay. We can adjust for that, and that can be considered within the normal realm. But if you're having a period that is maybe 1 month 14 days and 1 month 27 days, 1 month 32 days, then we really want to work on getting that a little bit more regular. A period should last approximately 4 days, right? And it should start and stop succinctly. So we shouldn't see a lot of spotting or hesitant start to the cycle, and we also shouldn't see it dragging on into 7, 8, 9, 10, 11 days or what have you. The period should not be overly heavy, nor should it be overly light. We should only see you changing a pad or tampon approximately every 4 hours, right? So anything less or more than that is certainly something to work on. Anything other than a little bit of minor PMS symptoms is not normal. So we shouldn't really be seeing any mood changes, any pain, any cramping, hot flashes before periods, insomnia, mood swings, all of that kind of stuff is not considered normal, and it is something that we can work on. For specific fertility considerations, we also want to look at the mid-cycle. So we want to see that ovulation is occurring, and we want to see that it's a regular occurrence and that it's occurring where it should in the cycle. Okay. For fertility patients, we also want to take a look at egg quality and look at how we can optimize those things. If you've been diagnosed with something like PCOS or fibroids or endometriosis, this is absolutely something that we can work on as well. There are a lot of natural fertility treatments that can help to regulate these imbalances and support your overall health, regardless if you're trying for a baby or not. If you are in the process of fertility treatments, this is something that all of the recommendations that I'm going to be giving you today and all of the things that I do with patients in the office or online are absolutely things that can be combined with conventional medicine. So whether you are just looking to regulate your hormones, whether you are looking to have a baby in the next 3 to 5 years, 1 year, 2 months, whatever it is, or whether you're currently in the process of trying or undergoing fertility treatments right now, it's something that we can help support you with. Okay, so there are of course some variations to that perfect period. Life is not perfect, and we can accept some, small variances from what I just described. But if you're seeing any major deviations from that, that's where you want to do a little bit of work. The bottom line basically is if you are experiencing any sort of distressing symptom, something that you're complaining to your girlfriends about, something that you are having a tough time with, then that's definitely something that we should work on. So now with that said, let's get into our top 3 tips for hormonal regulation and balance. So this is something that I often do in my practice. I certainly do a lot of supplement recommendations and herbal medicines and acupuncture, but what I'm mostly trying to encourage my patients to do is take action with their lifestyle and their diet. Overall, I believe that if we live well, then we'll feel well. And so that means incorporating things into our everyday that helps to support our overall health. Okay, so my very first tip for achieving optimal hormone balance is incorporating ground flax seeds into your everyday. So ground flax seeds are a source of phytoestrogens. The dosage is about 2 tablespoons a day, and what this is going to help with is symptoms of either low estrogen, so inadequate uterine linings, or also symptoms of high estrogen, which can be things like fibroids and endometriosis. So you do want to make sure you're getting the ground flaxseed. You're not going to be getting the same benefits from the whole seed or from flax oil. You can absolutely purchase the flax seeds already ground. You don't have to grind them yourself. But should you wish to, you can bring them home, grind them up in a coffee grinder, and store them in the fridge so they'll stay a little bit fresher. Then just take that 2 tablespoons, add that to your yogurts, to your smoothies, to your oatmeal, applesauce, sprinkle it onto a salad, whatever works for you, And if those things aren't a part of your regular diet, then just take the 2 tablespoons, whisk them up into some water, and drink them down. So that's our very first tip for optimal hormone balance, 2 tablespoons of ground flax seeds a day. Now, the second tip for optimal hormone balance is surrounding stress. So stress is another really big factor when it comes to hormone balance. It's one of the checkpoints on our optimal fertility checklist, and it's also one of the pillars in the Fertility Foundations program. Now, there's probably 100 recommendations I can give to you to support the stress response, but the one that's going to be most impactful for hormone balance is going to be sleep. So sleep, ideally we should be looking for about 7 to 9 hours of sleep a night. So whatever you need to do to get this set up for yourself, do it. Usually you want to look at what time you have to wake up in the morning and then count back that 7 to 8 hours to figure out what time you need to get to bed. Sleep is the time that our body gets into parasympathetic mode. It's the time that we have to rest, rejuvenate, repair, and our body gets a bit of a reset. And this is also true for hormones. This is when our hormones have a chance to reset themselves. So sleep is critical, critical, critical. What you want to do is create a wind down routine in the evening. So before bed, just quieting down, something similar to what we do with children. We get them into a bedtime routine so that they can have a good night's sleep, because we all know what kids are like if they haven't gotten enough sleep in a particular night, right? The next day is a nightmare. As adults, we can get through it without having an absolute tantrum on the grocery store floor, but that requires a lot of stress hormones to keep it together the next day. So if this is something that's chronically happening, you can imagine how many stress hormones are building. And when we're talking about fertility, the more stress that we have, the more stress that we have to modulate, the more that our progesterone gets depleted. And progesterone, of course, is really important for maintaining a pregnancy. So stress modulation is key. So a wind down routine could look something like reading a book, having a nice warm bath, a cup of tea, doing something mindful, some sort of mindfulness practice like journaling, like deep breathing, like meditation. You can include essential oils. Lavender is always a classic essential oil for relaxation. And you want to really be sleeping in a dark room, as dark as possible. So not even the light from your clock. Keep it really dark and keep it nice and cool. Now, if you have all of these conditions set up for optimal sleep and you are still not able to fall asleep, not able to stay asleep, you have a disturbed night or restless sleep, or you wake feeling unrefreshed in the morning, then that's something to go speak with either your healthcare provider or your holistic healthcare provider about and get that rectified. Okay, so tip number 2 is 7 to 8 hours of refreshing, restorative sleep. And then the third tip that I have for optimal hormone balance is probably the one that I'm most passionate about. And this is what really sparked my passion for fertility. It was years ago I started to do some environmental medicine training. And that is looking at the way our environment is affecting our health. So looking at the environmental exposures that we have and the chemical exposures that we have and how that has an impact. Now, one of the tip for our third tip is going to be avoiding endocrine disruptors or hormone disruptors. So we hear a lot about hormone disruptors out there, and there are literally hundreds of different kinds of chemical compounds that can really disrupt your hormone system. I'm going to talk about two today, and that is phthalates and bisphenol A, or BPA. So before we get into those, I want to kind of just explain how endocrine disruption occurs, and this is going to be a very simplistic explanation, but just to give you sort of a visual on how this is happening. The cells in our body all contain receptor sites, and receptor sites are kind of like docking stations for hormones. And so the hormones that are traveling through your system, through your blood, they come along, they can attach or dock onto this receptor site, and then they send a message to the cell so the cell can have an action. And this is how our hormones work. What endocrine disruptors do, or hormone disruptors do, is they come and they scramble up that docking station. So they hide it, or they change its shape, or they sit on top of it so that the hormones can't actually come along and dock onto the cell. So the cell doesn't get a message and the cell provides no action. So sometimes this can explain why we see on blood work that everything is normal, but you're not feeling well, or you're still experiencing symptoms of low or high, hormone function. So if we can avoid these two common endocrine disruptors, it's a fantastic start. So I'm picking these two because they're most readily found in our everyday lives. So let's discuss phthalates first. Phthalates are compounds that we find in fragrance. So they are chemicals that help with the staying power of fragrance. They help smells to last for longer or linger for longer. So they're going to be found in things like your personal care products, your deodorants, your perfumes, your colognes, your body lotion, your body wash, your body soap, all of that kind of stuff is going to have fragrance in it typically. So will your scented candles, your wax melts, your room deodorizers, your air fresheners, all those sprays, Febreze, laundry products, cleaning products, they all contain smells or fragrance, to make our house smell good, right? But any label that you see where you see the words fragrance or perfume, those are things that you should avoid. And instead you want to swap them out for more green or natural alternatives. So if you see on the label, that it's scented with essential oils, that's okay. That would be a great alternative to the fragrance or the perfume. So you want to look for more organic, natural, and friendly products out there. My recommendation would be just to start slow. Pick one thing at a time and start to switch things over in your house until you have all natural products. As far as fertility is concerned, phthalates have a really detrimental effect on egg quality and sperm quality. So big no-nos. Embryos are so sensitive to smells, and we really want to kind of eliminate them as much as possible. Okay, so now on to bisphenol A. Probably the poster child of endocrine disruption, and BPA is something that many of us are aware is found in plastics, right? So bisphenol A is a plasticizer. It is a huge endocrine disruptor, as I mentioned. In one particular study, and this was a fertility study, they found that women who were exposed to BPA actually had a higher risk of miscarriage. And for those that did deliver a baby, there were a higher risk of birth defects. So if this is something that you can remove from your home, sometimes it's not completely avoidable, but whatever little change you can make will certainly have an impact. And the things that you want to look for here, the big ticket items, are going to be your food storage containers. This is going to be your water bottles. This is going to be your Tupperware or plastic, leftover containers that you use in your kitchen. So swapping out for glass or stainless steel would be your best bets, right? Glass water bottles, stainless steel water bottles, and then either glass or stainless steel containers. Stainless steel is a really great option for kids, because glass can get really heavy and it's certainly breakable. Where I find these alternative products, so the glass and the stainless steel and the naturally scented products would be, your local eco-friendly store. But there's a lot of online places to find these things too, and a lot of common stores are really jumping on board too. So you've just got to kind of read your labels, do your research, and make some informed decisions with what you're buying. So that's number 3. We're going to avoid endocrine disruptors, and specifically bisphenol and phthalates. So just to recap, our top 3 tips for hormone balance are including ground flax seeds into your everyday, so 2 tablespoons of ground flax each and every day. Getting adequate sleep every night, so at least 7 to 8 hours. Maybe that's a little bit more like 9 hours for some people. And number 3 is going to be avoiding these endocrine disruptors, and specifically your plastics and fragrance. So I hope that these tips that I've provided you with today are really some implementable things that you can incorporate into your everyday life. I hope that you can easily add them into your day-to-day. I appreciate the time that you've taken to be here today to listen to this video. And what I'd like to leave you with is an opportunity to book a fertility assessment. So I offer a free fertility assessment for patients looking to optimize their fertility. And again, whether you are looking at having children down the road in a couple years from now, if you are actively trying currently, or even if you are already in the process of IVF or IUI and natural and conventional fertility treatments, I invite you to have a chat. And I'll also provide a link to download the full optimal fertility checklist, so you can have a look as well to see maybe what areas could be improved on. So thank you again for your time. I understand that you probably have 100 other things to be doing, so I really value the time that you've spent in listening to this video, and I'm grateful for the proactive approach that you're taking in your health. Thank you.